to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we have Dawn Baker. She is an anesthesiologist, and she wrote the Kevin MD article, The Voices of Women Physicians with Infertility. Dawn, welcome to the show.
Thank you, Kevin. I'm so excited to be here.
We'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Yeah, well, I'm an anesthesiologist, and I have been out of my residency training for approximately 10 years. We're doing this podcast in winter, and I graduated late. I actually graduated about exactly 10 years from now, because I had some sick leave that I had to do during my residency. And to make a long story short, I ended up having a pituitary tumor that took a long time to diagnose while I was in training and really too busy to pay attention to my own wellness and health. And it was through just innocuous fertility workup that the diagnosis really started. So on that path, I knew that I wanted to share what I had done to regain my health. And in thinking that some of my symptoms were related to burnout, I started out writing about physician burnout and more of that kind of in the wellness range. And that has really changed to encompass lots of different subjects on my blog, which has grown into a speaking career and also life coaching for other physicians who want to attain better work-life balance, and now encompassing physicians who are going through infertility diagnosis and treatment.
So tell me, what are some of the things that you did to overcome some of the health challenges that you had during your medical education journey?
Yeah, so it was a difficult time, as you can imagine, because we're all very, very busy and have very limited time off. But I was forced to take time off because I had this illness. So I really prioritized sleep, as we all should be doing, but difficult to do. I learned about mindfulness and meditation and tried lots of different modalities of that. Really learned a lot about myself by going deep into reading, researching, doing assessments to figure out things about myself, like if I was an introvert or an extrovert, what kind of things I like to do, what kind of things I gained energy from, or what kind of things zapped my energy. And it seems like we would know these things about each other, or about ourselves, but we actually don't. We are kind of blind to a lot of the things that we really like and dislike when we go into medicine, because we're just focused on that one thing and our training. And so I learned a lot about myself and ways that I could take care of myself better, specifically for me.
So tell me some of these lessons that you learned for yourself and how you apply them in your coaching with other physicians.
Yeah, so I would say one of the really important things that I learned was what my values are. I always take my clients on a journey into figuring out what their core values are, the things that really resonate with them, and then that can shape the kind of work situation that they should be striving for. One main thing that I figured out about myself was that I was really an introvert. And so in order to rest and to rejuvenate, when I am in certain social situations, I needed to be by myself. And spending a lot of time by ourselves is not something that oftentimes is valued. We think that we need to be out and about and doing social things all the time, but it can actually be counterproductive for certain people. So that was really useful. And then I figured out through some self-assessments, such as the 5 love languages, how to better exist in my relationship with my spouse, and also through the 4 tendencies, which is something that I teach on with coaching, how to respond better to my habit formations as far as losing bad habits and then gaining better habits or adopting new habits.
All right, let's transition now into the Kevin MD article that you wrote. It's titled, The Voices of Women Physicians with Infertility. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, so I have been coaching on work-life balance and writing about work-life balance for a while, but a big pivotal part of my work-life balance is being a mother. And that journey was a long one for me because through my severe illness in residency, which was a pituitary tumor diagnosis and then a surgery and resection, I was left with infertility. So I found myself in a place as a young attending, navigating infertility treatments. And I realized that that is a very, very unique set of difficult situations. To be a new physician, to be the kind of person that you're getting your feet wet in a practice, navigating, not having all of your vested benefits maybe, or being the low person on the totem pole when it comes to leave and vacation, and then being in an environment where it's very difficult to take time off. I struggled myself with journey, but I was successful. I did have a daughter, and so she's a big part of why I decide to work the way that I work and do the kinds of hours and different things that I do. So I began researching infertility by talking a little bit to other women that had a similar situation to me. And I decided when I was chosen to do a speech at an upcoming conference that I would talk about this situation. And infertility is actually quite common, and it is even more common in physicians. So this is a big issue that if you're not dealing with as a woman physician, you're going to have colleagues that are dealing with this issue. And so it affects all of us as far as our workplace wellness kind of climates. So I decided as part of my preparation for the speech that I would do a survey of women physicians who have navigated infertility on any kind of level. Either they have started or they finished an infertility journey. And I put this survey out and I got an overwhelming response in the infertility Facebook groups that I'm in for women physicians. I realized that they really wanted a voice for the things that they have been going through so that people can understand. And a big part of it is that a lot of people like to keep it a secret. I was very open about my infertility and about the kind of things that I needed when I was working and going through treatments, but some people really don't want their colleagues to know. They really don't want to talk about it. They want to keep it private because it still has a lot of stigma associated with it. Mm-hmm. So I wrote this article to summarize what some of the women said to me and to give them a voice for the issues that they've been dealing with being a physician and having infertility.
Now, you mentioned how difficult was being a new attending and also having to deal with infertility. Now, take us through perhaps some of a representative day that really articulates some of those challenges that you faced.
Yeah, so there's a perfect storm of a situation where you're very anxious because you have a lot of uncertainty with infertility. Treatments can change from a day-to-day basis. You can have this plan where you're going to, for instance, if you're doing in vitro fertilization, you're going to have an egg retrieval on a certain day. And then that day may change by 1 to 3 days. So you can't plan in advance for time off, but you're also say you're a brand new physician in a group. How do you navigate getting that time off when you have a full schedule of patients? Or maybe you have an OR schedule, or you're a surgeon and you actually are, have your patients that are scheduled for surgery on a certain day. It's very difficult to cancel a whole day of clinic or a whole day in the operating room without disappointing a whole lot of people and messing up a big schedule for a whole team. So that is very anxiety provoking. And then not wanting to talk about the subject can bring in even a whole other level there. On top of that, we all have most of us have a lot of debt from our medical training, medical school and residency, and infertility is not cheap. Infertility treatments are most often something that is paid out of pocket. There are some insurances that cover that, and it's becoming a little more common, but it wasn't so until more recently. So then that brings another aspect, which is the financial aspect.
So what are some of the things that you did or people that you turned to for support during that difficult time?
I think it's really important to have some sort of a support system. And when I surveyed the other women physicians in this cohort, they all said the same thing. I mean, most of them also made a comment that it's very important to have an open line of communication with your spouse or whoever you are on the journey of infertility with, but at the same time, having another type of a support system of an objective third party, whether that be a trusted friend or family member, or a therapist, a counselor, a coach, or even if you want to be a little more anonymous, a group such as a Facebook group. There are a couple of different Facebook groups that are private, but that you can find for women physicians that are undergoing infertility. And some of the physicians that I surveyed really mentioned how useful that group was, and just how important it was to them. For me, I definitely confided in key players at work and told people like the operating room scheduler, the anesthesia group scheduler, so that they understood what I was going through and how I would need to have some kind of leeway in my schedule. And also, I had personally a very supportive spouse and a good, open relationship there. And I did use some counseling and some coaching while I was undergoing my infertility.
Now, how about the hospital and the administration? How accommodating were they?
So in my personal experience, I did not have too much trouble. However, I did use vacation time to do some of the periods of time that I needed to do treatments, and as opposed to using it for something fun or, going on a trip. And it really depends on your system. For me, I was able to get vacation without too much lead time, but not everybody is lucky in that sense. And some hospital systems and some practice groups actually have punitive repercussions if you do take time off with really short notice. And that's very sad. I heard lots of stories through this survey of people who said, I can't ask for time off if it's more than 2 days in a row without 3 months in advance. Now, I didn't have that issue, so I didn't have any kind of problems. People talked about being written up for, quote, unplanned absences or difficulties with, needing to cancel patients in clinic because they had to, at the drop of a hat, go to an appointment or a procedure.
Now that you've had time to reflect on this experience, is there anything that you would have done differently?
Yes, personally, there is something I would have done differently. And I think that any person is going to answer this different because infertility diagnoses and journeys are all very individual. But for me, I'm a second career physician. So I worked as an engineer for a while and went to medical school late. And so you can imagine that my childbearing years came sooner in my training trajectory there to become a physician. I wish that I had started sooner in retrospect. That's really hard to do now. I mean, it's something that you can't just say like, oh, I wish I did this because everything was the way that it was. I mean, I feel like that a lot of women, though, when I surveyed them, did say the same thing, where they said, start early, investigate early, escalate early. So my other thing that I wish that I had done was that I wished that I hadn't kind of dawdled around on my diagnosis and the fact that I had some covert symptoms and things going on that initiated this fertility workup. I wish I had been a little more vigilant about it and started it sooner, because the older you get, if you have any kind of organic infertility diagnosis, age just compounds your ability to get pregnant, and makes it even harder.
We're talking to Dawn Baker. She's an anesthesiologist, and she wrote the Kevin MD article, The Voices of Women Physicians with Infertility. Dawn, for those other female physicians who are going through medical training or are new attendings, also going through the infertility journey, what are some of your top tips for them?
My top tip is to remember that you are not alone. There are other people going through this, and people that you don't even know that are going through this that don't want to say anything. So find a trusted colleague, find a friend, find a coach, find a therapist or someone that you can talk to so that you can navigate all of the feelings that you're having with the help of somebody else and not feel too isolated, not feel too much shame and guilt. And then I would say that, like I was mentioning about my learned lessons, make sure that you advocate for yourself, that you remember what your priorities are, and the fact that even though being a physician is very important to you, that your family life is also super important, and making sure that you talk to different people that have gone through what you're now navigating so that you can figure out their learned lessons as well.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
On a general level, I would say the very important key to work-life balance and wellness as a physician or any other professional is to take some time to learn about yourself. Take some self-assessments, read books about mindfulness, read books about self-care, figure out what works for you and figure out your unique set of values. And that will help you to navigate any kind of work-life balance situations and make the right choices that are going to help you to have a long and fulfilling career.
Dawn, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you so much.